Hi, this is Joni. I just wanted to take a minute and talk about the subgaleal hemorrhage assessment policy and kind of answer some of the frequently asked questions that me and Christine has been getting about this policy and the changes that have come across from it. So first off, any delivery that uses a vacuum or a forceps would fall underneath this policy. So that includes failed forceps, failed vacuums, and vacuums that are used in C-sections. That is something that these babies are all at risk for the subgaleal hemorrhage because of the fact that we've put traction, that we've put a mechanical object on their head, which would lead to the severing of blood vessels, which would cause this issue. So that's why we're going to go ahead and make that blanket statement to say these babies all need this assessment. Second, we need to obtain the cord gas, and this needs to be done obviously at the time of delivery. So for an intervention to kind of help remind everybody that this is the new way of doing things, we're going to be putting stickers on all the vacuums and the forceps packaging to kind of give you that visual reminder that we need to grab those cord gases. So this is something that you're going to have to help the providers remember as well, and start making that a new habit for yourself. The OFC measuring tapes, they can be found in the team room at this moment. Once we get a par level, we're going to stock them in the panda warmers in the top drawer, and the unit techs will be responsible for making sure that those stay stocked. The documentation forms that we need to use until Cerner goes live are going to be also found with the OFC measuring tapes. I've put packets together that include the documentation as well as the algorithm, so you can keep those at your computer desktop to remind yourself of the algorithm. And those will be stocked with those OFC measuring tapes, so you can find that there. If you don't have those forms, you can find additional copies at the HUC desk in the drawer that pulls out with all the extra documentation. So this education is required for all the nurses. Please complete that education in the room prior to January 31st. It is composed of several things that you could read. There's a video component to really dive into the pathophysiology, and then there's also that hands-on learning component. The hands-on learning component is not meant to be easy because if you're assessing this on a baby, it's not always obvious. So it was designed that way. Do the best you can. If you have any questions, if you want to talk through things, I am always available to talk to you. If you're on night shift, please just send me an email and I will make arrangements to be here when you're here so we can discuss it in person. I've linked in the Stork Bites, you can find the link, of course, and of course you can go to Lucidoc to look at that policy. The assessment is required at birth and every 2 hours until the infant is 12 years old, and it is required that you complete a bedside assessment for all hands-off and reports. So both of the nurses need to verify that they assess the same finding. This will help catch any subtle changes in the assessment. So one of the things that we kind of thought about was if you have a baby that's being assessed for 12 hours, you could have 3 to 4 nurses actually doing this assessment on this baby. So it's imperative that you and the outgoing nurse understand what you're looking at so you can catch any of those subtle changes. And of course, the NICU charge nurses are always available for secondary consults. If you have any concerns, please call them. They will come down and assess these infants, and they can determine if the infant needs more aggressive monitoring or further interventions. So I know we've gotten a lot of comments about there's no real guidelines on what baby needs to be assessed by a NICU nurse, and that's where your assessment skills as a nurse come into play. If you're noticing something that you're concerned with, call them and have them come down. We're looking at changes. There could be subtle changes in the vital signs. There could be subtle changes in the assessment. And if you're concerned, we're concerned, and we want you to call that NICU nurse to get that second opinion. Even if it's just to call them and say, hey, I'm feeling this. Is this normal, not normal? Is it something that you need to to come down for. That's their part in the NICU, the PEDS world. That's what they've agreed to, and so we've agreed to do these assessments and with their support.
And I would just like to add, our charge nurses in the NICU have been very supportive. If this is your first time doing an assessment on your own, they have been very supportive in coming down to do that first assessment with you and kind of confirm that that is a correct assessment that you are feeling or what you're seeing, and just kind of help guide you through that. Don't hesitate to call them and just kind of have them walk you through that assessment. Our FMC postpartum charge nurses and labor charge nurses are also available for that, and they may have had more of these assessments than you have. So just keep that in mind as a resource in your back pocket.
All right, thank you guys. You have a question, Mylan?
Yeah, so for cord classes and for people doing banking or donation, are we just not doing that so that we can hit the cord? Oh, it's recorded.
Yeah.
If a patient wants to do cord blood banking or donation and they end up with a vaginal operative delivery and we're supposed to get the cord gases, how do we manage those two things? Getting the cord blood gases and the cord blood donation.
That's a really good question. I mean, you only need a small portion of the cord clamped off in order to grab this assessment. So I would probably say try. I don't know. What do you think, Christine?
I would honestly think that this would be a conversation for the patient and the provider when they're having that conversation about having a vacuum delivery. I would think that this is something that they would discuss with the patient and let them know why cord gases would be important, and that might take precedence over doing cord blood donation. I think cord blood banking might be a little bit harder of a decision to make.
Yeah, that's a good
than
question.
Cord blood donation. I don't know that we have a good, clear answer for that, but always involving the patient in that discussion, I think.